Now to our other big talking point this week, combating drug abuse. A trial to prescribe heroin to addicts in a bid to cut crime could be underway in the West Midlands Police Force area within the next few months. The Police Commissioner David Jamieson is also looking at facilities for clubbers where so-called party drugs like ecstasy could be safety tested. He's been to Switzerland to see these measures in operation, and Rob Mayer went with him.
Geneva, a famous city in a country with similar drug laws to the UK, but where the approach to drug users is entirely different. After a 1990s AIDS epidemic among heroin users, it was decided things here had to change. Around 100 people every day use this drug consumption room. They buy their own drugs on the black market and can take them inside without fear of arrest by the police. Perhaps most astonishingly, rather than being tucked away on a back street, it's a bright green building in the middle of a busy traffic island next to the main station in Geneva, and it's quite clear what it's being used for. West Midlands Police Commissioner David Jamieson said earlier this year he'd consider the merits of facilities like this one.
We have 6 places for injection.
The idea is to stop users injecting on the street and reduce the spread of disease.
I think there's a lot to learn from here, and I think we need to look very carefully at what they're doing to see what works and what doesn't work.
A short tram ride away, heroin addicts are prescribed the drug in a medical setting. This programme's been running for 10 years, regulating drug supply, suppressing the black market and removing the need for users to fund their habit through crime. It's also seen the instance of HIV among users fall from above 70% in the early 90s to less than 10% now.
They can clean everything, they can inject themselves, and after that they go out, they have their own lives, they are stable, they have their own activities, the families, etc. So
it makes a big difference to their lives.
Yeah, I think that it's quite an important change in their lives in a positive way.
Unlike consumption rooms, heroin-assisted treatment is legal in the UK. It's likely to be up and running in the West Midlands in the next few months. Another service to be rolled out, the testing of so-called party drugs like MDMA, commonly known as ecstasy. They've been doing it in Bern for 20 years. At this lab, clubbers can drop off samples of what they plan to take at the weekend. It's taken just 20 minutes to analyse this sample. We've learnt that it's MDMA and it's at twice the normal dose. Now, because of that, a warning will go on a national website, and the person who brought this sample in will get a telephone call to warn them that it's strong stuff as well. Lab staff who run a mobile version at music festivals say many people choose to dispose of their drugs after finding out what's in them. It does mean the police turning a blind eye to some illegal drug consumption. Critics say that's soft on drugs, but it's claimed law enforcement feels the benefits as well.
Law enforcement at the beginning actually agreed to have drug testing in the city, because they knew they would get some insights they wouldn't have otherwise. These are things that give you insights into drug-consuming behaviour you wouldn't have otherwise.
In the West Midlands, there's a drug-related death every 3 days, whilst drug-related crime and health problems cost £1.4 billion a year. The change of approach in Switzerland was driven by former socialist president Ruth Dreifuss. She says it was a similar cost which made it politically acceptable.
We had a very harsh teacher. The teacher was called HIV, AIDS. He killed people. The contamination took place through injecting drugs, and we had also a large toll in overdoses. So we had really to do something to solve this problem.
The West Midlands Police and Crime Commissioner is hoping the same will be true here.
They've taken some of the drug pushers and other things off the streets, so those are the things that I've seen. It's up to us now to go back to the West Midlands and actually say to ourselves, what can we learn from this and how can we use that for our own experience?
David Jamieson ending that report by Rob Mayer in Switzerland. And it seems Mr Jamieson will actually be the last West Midlands Police Commissioner. The Policing Minister, Nick Hurd, has confirmed government plans for the Metro Mayor to take over responsibility for both the police and fire services in the West Midlands Force area from 2020. And we'll come into the substantive drugs issue in a moment, James, but again, as a architect of devolution, this is quite a top-down, significant change to police accountability. What happened to the idea of direct accountability via a commissioner? It's now being subsumed into a role that was set up for other reasons altogether.
No, I think that the vision of devolution actually was for the mayors to take on significant powers. So in London, the London Mayor chairs the Metropolitan Police Authority, so it's a logical step for the mayor to take on responsibility for policing, making a much more coherent strategy for policing across the West Midlands.
OK, well, to come to the substance of that report, doesn't it really look like condoning drugs? I mean, there are extraordinary images and thoughts we're getting back from Switzerland.
So I do worry that taking a more permissive approach will have unintended consequences. Big cultural differences between Switzerland and the West Midlands. I'm very open to looking at new ideas, but one of the issues with David Jamieson as a police and crime commissioner is he's very often tried to drive media headlines rather than taking the right decisions for the West Midlands. He did that on police numbers and police stations, very driven by politics. I'm very open to new ideas.
As a former judge yourself, how does this strike you? Because it does look like going soft on drugs.
Absolutely not. I think James obviously hasn't been listening to the package, because it's quite clear that it's not about going soft on drugs. It's not about legalisation of drugs at all. It's about treating people who have, for whatever reason, and the ONS have figures that in areas where there have been cuts in local authority funding and where drugs and alcohol services don't exist anymore because of the cuts to local government funding, that those areas see the highest rates of people who are dying. People are dying. We have to do something. It seems to work in Switzerland, it works in Portugal, but let's have a trial. Let's see how we can save those costs and save lives. That's the most important thing.
But bearing in mind this potential change in the mayoral remit, how are you on drugs enforcement, stop and search, and all these policies we're talking about here today?
Just be really clear what's proposed. That David Jamieson was elected up to 2020. I was elected up to 2020. This arrangement would apply, if agreed, with the support of the local authorities as well, so that's very democratic. It would apply to whoever is mayor in the future. So there's nothing undemocratic about this at all. My own reaction to the film is that it's good that it's being explored. I went to Finland to explore something. Housing First landed a scheme here. It is right that leaders go and look. My own view is that some of the ideas on there are actually very positive. Some of them are not right, and there's a whole other story about the prevention, the economic pieces, and that's where in my current role I can make a difference, and if the two roles were to come together, it would be more effective.
And it does relate to some of the big structural problems with rough sleeping and other issues that we've been talking about generally across this agenda, doesn't it? For the moment, I think we'll leave this one there for the moment, so thank you very much indeed.